symptoms. So obviously, green light reflex is all about what's happening at the back of the body, right? We call it the posterior chain. So we're looking at things that are affecting the back. So we've got low back pain, SI joint pain, piriformis syndrome, again, because those glutes are just so tight and the legs are externally rotating. So there's a lot of compression inside the actual hip joint itself. So the muscles that attach the hip bone into the pelvis can get very tight, very affected. So anything in the lower extremities, so hips, knees, feet. So that leads us into plantar fasciitis. So really common diagnosis for a lot of people is plantar fasciitis. And often the treatment is site treating. So, ball rolling and foot massaging and different things like that. But in fact, what we recognize now is that has to do with the green light posture. And if you think about, you take the material on your shirt as an example. If I was to pull the material on my shirt, right, the arm gets pulled in, the arm of the shirt gets pulled in like this, right? So when we have something is short, it's pulling something together. So in this case, when we have the whole back of the body is really, really tight, well, part of that is the soles of the feet. So you've got this pull coming up like this. So the soles of feet are getting yanked and very tight. And so when we walk, your feet should feel nice and soft. So they're padding, right? So as you hit the ground, you got that nice padding. And someone who's dealing with plantar fasciitis will almost feel like it's hard as a rock and it's hitting the ground very hard. That's because the tissues are pulled really tight. So when we have something like plantar fasciitis or a lot of these other things that we're going to learn about, we want to release the thing that's pulling in order for the feet to feel better. So we have to go into the trunk of the body to release the green light pattern, and that will have a residual effect both up and down. So neck pain, restricted range of motion of head, tension headaches, right? But again, remember with the muscles, they can come right up to the head. So if you've got really tight back line, you've got all of this pull coming from the back that's going to cause all that tension to come up through the head and the neck. Shoulder issues,